In this video, I'm going to explain the 4 main reasons flare-ups occur and how identifying the reason for your flare-up can direct you to use the right strategies or practices. Do you feel lost and confused as to why you're having another pain or symptom flare? Well, flare-ups are often not a sign that your body is damaged or diseased. They're a sign that your nervous system is stuck in this heightened state of danger. Now, I know personally how difficult flare-ups are to have and how they can make you start to doubt that you're using the right strategies or practices to heal. My name's Tanner Murtagh, and I'm a therapist that has been on a mission for the last 5 years to find the best way to support people in healing their chronic pain and chronic symptoms. Now, as we know from the latest research and neuroscience, many forms of chronic pain or symptoms are neuroplastic. So what this means is that your pain or symptom is not due to damage or disease in your body. It's due to your brain and nervous system being stuck in this heightened state of danger and survival. As people start to understand that their pain or symptoms are neuroplastic, they start to use the brain-based strategies and practices to heal. And for a lot of people, they start to see progress. Their symptoms gradually start to reduce. They start to re-engage in living life and doing movements, and they start to feel free and alive. Unfortunately, then a flare-up hits, and it stops us dead in our tracks. We start to doubt that our symptoms are neuroplastic, and we start to doubt that we're even using the right approach. I get it, flare-ups are scary and they're awful, but I want you to know, in the hundreds of therapy clients I have worked with, every single one of them had flare-ups along the way while they are healing. So it's really vital to understand that flare-ups are a normal part of the process. The starting place to overcoming a symptom flare-up is identifying the reason it is occurring. Now, me and my team of therapists have come to understand that there are 4 main reasons for neuroplastic symptom flare-ups. Now, I'm going to go through these 4 reasons, but as I do, see what ones you relate to and what ones could be causing your current flare-up. I also want to be clear, there could be more than one reason your flare-up is occurring. Let's dive in. Number 1, associations. Pain and symptoms might be trying to protect you from movements, positions, activities, people, places, certain environments, or certain stimuli that your brain has started to learn is dangerous. Anyone who has chronic pain and chronic symptoms, your brain has made associations. So a classic one is for someone who has back pain, their brain started to associate bending forward equals danger. And so as a result, bending forward will trigger pain. Now, before coming to understand that your symptoms are neuroplastic, you probably thought the movements, positions, activities, or other stimuli were actually causing damage to your body, and that's why it was triggering pain. But when pain's neuroplastic, this is not the case. All that's happened is your brain has started to label that these conditions are threatening and dangerous. So as a result, it triggers pain, fatigue, or other symptoms. Now, as we're healing from neuroplastic pain, we need to start to break these associations. We need to start moving. We need to start re-engaging activities, being in the outside world, going back to work. And this is an essential part of the healing. But as you do this, as you start to break these associations, you start to face your fears, you can get symptom flare-ups. And this is normal. I find when people start to break those associations too quickly, it can cause a flare. So if someone was practicing bending that had back pain. And at first, they were bending 5 times a day forward. It was going good. And then they got up some courage, and one day they bent over repetitively like 100 times. Again, they're not damaging their body when their symptoms are neuroplastic, but their brain is probably going to freak out and as a result produce a flare. So if you've been approaching your associations too quickly, and that's the reason for your flare-up, you just need to back off for a bit. Slow down, use some strategic avoidance, pause the bending forward or whatever other movement or activity you were facing. And then once the flare-up subsides, get back to approaching breaking those associations. Number 2, you're outside the healing window. Now, in my approach, I talk about a concept of the healing window. So, part of healing neuroplastic pain and symptoms is approaching unpleasant things. You're approaching pain and symptoms in your body. You're approaching emotions. You're approaching breaking those associations, starting to move more, starting to do activities or go back to work. This is exposure. And as you do exposure, it will be unpleasant. But when I talk about exposure work with people, we want to stay in the healing window. Now, I want to be clear, within this window, it's unpleasant. You're approaching pain, emotions, activities or movements that feel really scary. But when you're in the window, you can tolerate it. You can tolerate the exposure work, even though it's slightly dysregulating. But if you do the exposure work too intensely, you're all of a sudden going to be outside that window. And now you can't tolerate it. So if you go outside the window while doing exposure work, what happens is nervous system dysregulation is going to increase very quickly. You're going to get a sharp burst of fight, flight, fawn, freeze, or shutdown energy. And as that occurs, it sensitizes your brain and it can trigger a flare-up. So I see this as one of the main reasons a flare-up occurs is people were doing exposure work, which is good, you need to do it, but they were outside the healing window as they did that. And if you're outside that healing window, yes, you are going to be more vulnerable to flare-ups. So if you've identified, this is the reason my flare-up occurred. I was doing too much somatic work with pain and symptoms or emotions, or I was approaching breaking those associations too quickly. So great, you've identified I was, doing the healing work outside the healing window. Now you got to slow it down. Take a pause from the exposure work. Use safety signals like breath work, safe self-talk, visualization, could be slow somatic movements, or tapping and massage. Use some safety signals, bring some calmness, regulation back on board. That's going to help the flare-up reduce. And then once the flare-up reduces, go back to doing the exposure work to sensations or outside activities. But when you return to the exposure work, make sure you're doing it at a good pace, that you're within the healing window. Number 3, difficult emotions and dysregulation. When a flare-up occurs, it's helpful to reflect on if any difficult emotions or nervous system dysregulation was occurring right before your flare-up occurred. Because this can help you understand that your body is not damaged in any way, you didn't injure yourself. All that's happening is the difficult emotions, the dysregulation was probably too high, it increased nervous system sensitization, and you got this flare-up of pain or symptoms. Identifying that there's a connection between the difficult emotion or situation that happened right before the flare-up helps you understand that your body is safe and healthy. Now, I like how Dr. Howard Schubiner talks about in his approach, walking it back. So when a flare-up occurs, you want to walk it back a few hours, a few days, a few weeks. and understand, did anything stressful occur? Was there conflict in a relationship? Or was I just feeling really anxious or shut down? Walk it back and make this connection. And if you've identified, oh, this is why my flare-up's occurring, it's a great time to start doing somatic work with the emotions or dysregulation. Get that exposure to feeling the emotion or dysregulation that's fueling your flare-up, and then create safety with it. And by doing this, we're teaching our brain we don't need to be so worried about the flare-up. We can attend to our emotions and we can learn to feel safe with them. And in my experience working with people, that can help the flare-up reduce much more quickly if they move to actually attending to the emotion. Now, when I was healing, I had many examples of emotions causing flare-ups. I remember one happened when me and my wife, Anne, went to Mexico for a week. And we had saved up a lot of money. It was, a really important trip for us. We were really excited. And when we got there, the hotel was in utter chaos. At first, they didn't know if they had our room. And then we got a room and it was just terrible. It looked like a broom closet. And I remember feeling really angry. I remember feeling furious of like, I've spent all this money. We saved up for a year. And this is how they're treating us. Instantly, I got this flare of back pain. And then quickly, my focus moved from feeling angry to being worried, oh, now my back's flared up and my whole vacation's ruined. Well, I walked it back. I walked it back to understand, hey, you're just angry. You're angry that your vacation isn't what you expected it to be. And so I shifted from worrying and focusing on my flare-up to just allowing myself to be really pissed off. I did the somatic work, feeling the anger. I talked it through with my wife, Anne. And after a few hours, that flare-up dissipated. But it dissipated because I processed the emotion that was sensitizing my system. And so really look out for this. If this is the reason your flare-up's occurring, you want to shift and focus on your emotion or dysregulation. Number 4. Extinction bursts. Alan Gordon, the creator of pain reprocessing therapy, talks about how a reinforced behavior doesn't go down without a fight. Now, pain and symptoms has been reinforced in your brain by fear, frustration, despair, avoidance behaviors, and negative self-talk. All of this danger has reinforced pain and symptoms probably for years for you. Now, when you come to a brain-based approach, you start to create safety. You start to do the somatic work. You fear your pain or symptoms less. You feel less dysregulated. You start to approach life again. And as that happens, pain and symptoms start to reduce. But as that reinforced behavior is becoming extinct, you're going to get an extinction burst. So it's going to feel like a random, spontaneous flare-up that just comes out of nowhere of your symptoms. And that's normal. Anytime a reinforced behavior is becoming extinct, you're going to get a burst of it. And that's why extinction bursts happen to so many people while they're getting better. For myself, I had many extinction bursts in the first year I was healing. So if you're starting to explore, okay, what's the reason for my flare-up? And you don't think it's due to an association, you don't think it's because you were outside the healing window, and you don't think it's because difficult emotions or dysregulation, it is probably due to an extinction burst. Now, the secret is to not freak out, understand extinction bursts are normal, and just stay consistent with the healing work. Over time, extinction bursts will fade out. We just need to trust that if we put in the work, they are going to fade out over time. So these are the 4 main reasons symptom flare-ups can occur. Up next, try out this safety and calmness meditation, as it's going to help regulate your nervous system and overcome your flare-up. I'll talk to you all soon. Take care.